just I'm here to share some random kind of thoughts with you. तो आजकल तो एक ही थॉट दिमाग में रहता है, दैट इज़ दिस कोविड सिचुएशन, एज टू व्हेन इज़ दिस सिचुएशन गोइंग टू ईज. कुछ पता नहीं है किसी को, क्योंकि ये नया वायरस है. हाउ इट्स गोइंग टू बिहेव, हाउ द पॉपुलेशन बिहेव्स इन रिस्पॉन्स टू इट, एट्सेट्रा एट्सेट्रा. किसी को कोई बहुत डेफिनेटिव नॉलेज तो नहीं है. And the government and all kinds of health officials and authorities etc. सब लोग डराने पे लगे हुए, थर्ड वेव आने वाली है, इट्स गोइंग टू बी अ किलर वेव, बच्चों पे ज़्यादा असर होगा, दिस दैट, everyone's going to die, no one will survive, the human race will perish or something. इस तरह की पता नहीं क्या क्या बकवास सुनने को मिलती है. The human race has evolved. My thoughts on this are कि ये जो ह्यूमन रेस है, इट हैज़ इवॉल्व्ड, द ह्यूमन सिविलाइजेशन, द ह्यूमन स्पीशीज़ हैज़ इवॉल्व्ड ओवर maybe millions of years, and we have seen hundreds of such viruses and such pandemics. They have happened, and there was one that happened about 100 years ago, and it did not finish us off. It killed a lot of people back then because मेडिकल फैसिलिटीज़ नहीं थी उस समय, मेडिकेशंस नहीं थी, डॉक्टर्स की अवेलेबिलिटी नहीं थी, हॉस्पिटल्स नहीं थे. दुनिया बहुत अलग थी आज के ज़माने से. मेडिकेशंस की कोई भी अवेलेबिलिटी नहीं थी, एंटीबायोटिक्स नहीं थी, स्टीरॉयड्स नहीं थी, कुछ नहीं था. आज दुनिया बदल चुकी है. उस ज़माने में तो वैक्सीन्स भी नहीं होती थी, अब तो हमने विद इन अ ईयर वैक्सीन्स डेवलप कर ली हैं, which really is an enormous achievement. I mean, think of this, these mRNA vaccines that have been developed take about a day to develop. Of course, the testing process and everything takes longer, but the vaccine itself takes about 1 day to develop. These mRNA vaccines take 1 day to develop. And since their development process is so quick, my view is that this will perhaps be the last pandemic. And also, my view is that at least in India, the pandemic is probably over. I'm sticking my neck out and saying this. 2 months down the line, there may be a lot of egg on my face. A third wave might actually even come. Who knows? But I'm not anticipating a third wave. And there are certain very simple reasons for this. If you consider our country, India, as the laboratory, then there's plenty of evidence that the third wave is not coming. I will tell you why. If you look at the northern states, even in fact you look at all of India almost, what you will observe is there are very few cases happening. The one state where lots of infections are happening these days is Kerala. And if you just go back to the sero survey done by the ICMR a few days back, a few weeks back, the survey says there was the lowest sero prevalence in Kerala. Even though it has the highest vaccination rates, the sero prevalence was the lowest. So what has happened in rest of India is there was very very high sero prevalence. 65%, 70% इस तरह का सेरो प्रेवलेंस था, which means that 65 to 70% of the population had been exposed to the virus. उनको वो infection हुआ and they recovered. They probably did not even get sick, most people, and now they have the antibodies. So with the presence of antibodies in most people, we've perhaps crossed that threshold of what is called herd immunity, and therefore I don't anticipate the possibility of a third wave. I don't anticipate a third wave actually. It's highly unlikely now that we are going to get a third wave, which is kind of good news, because it seems that natural immunity works a great deal better than vaccine induced immunity. And I'm not surprised about that. An immune system that has evolved over millions of years will always beat human technology. At least as of now it does. So I'm not anticipating a third wave, and that also means that I will be back with my students fairly soon in the maybe months to come. So perhaps in a couple of months time, We will be spending time in classrooms, having a lot more fun. These online classes are a drag. I don't enjoy these online classes as much as I enjoyed the classroom experiences. So, those are my thoughts. And of course, I might have egg on my face in a couple of months' time, and there might be a big COVID third wave, who knows, because the virus is relatively new. It's not very well understood how fast it mutates, but whatever evidence there is and whatever data there is seems to indicate that it's not going to happen, at least not in India. Elsewhere, where seroprevalence rates are lower in other countries, yes, they need to be more careful. Of course, even in India, we need to be careful. We never know how the virus is going to behave, but then my feeling is that natural immunity is working very well against this virus, and the pandemic could very well be over for India. So hope to see you all in the classes. So those are my thoughts on this pandemic issue. I also wanted to share my thoughts on a couple of other things, but then perhaps some other day. This will get a very long discussion kind of a video. So perhaps more on the other topics in the coming days. As of now, bye-bye. Enjoy yourself. Have fun.